All right. Hello and welcome again to another Move with a Doc. I'm Dr. Rupa Shah, board certified family physician and health and wellness coach. And as always, feel free to kind of move and stretch and take a short walk, anything, just getting a little bit of exercise throughout your day here while we chat today about vision health. So I want to start by talking about one of the most inevitable eye disorders that are associated with aging, and that is cataracts. So what is a cataract? A cataract is that dense, cloudy area that forms in the lens of your eye. And it begins when proteins in the eye start to kind of clump up and prevent the lens from sending clear images to the retina. These develop very slowly, kind of as we age, and then eventually it'll start interfering with your vision. You might end up with cataracts in both eyes. Normally, they don't form at the same time, but eventually they'll start affecting both eyes. And over half the people in the United States have cataracts or have undergone cataract surgery by the time that they're 80 years old. So very common eye condition. So what are some of the symptoms that you could be on the lookout for? Well, blurry vision, if you're starting to feel like you can't see clearly or you're having trouble seeing at night. That's a really common complaint that some people will complain about. Seeing colors as more faded, depigmented, increased sensitivity to glare, big halos around traffic lights or street lights. You may even see double vision in one of your eyes. And then just noticing that you're having to get your eyeglass prescriptions updated, that can be another signal that you might be developing a cataract. So some of the risk factors for cataract, as you might imagine, is getting older. So older age, but also heavy alcohol use, smoking, obesity, too much sun exposure. So do make sure to wear your sunglasses. And then having diabetes also puts you at risk. So treatments for cataracts, pretty simple. There's a simple surgery your ophthalmologist can perform, which involves removing that cloudy lens and then replacing it with an artificial intraocular lens right where that natural lens used to be, and kind of restores your vision. So let's move on to another condition that really can be problematic, and that is glaucoma. So glaucoma is kind of an enigma to some people. But what is glaucoma? So it kind of occurs really subtly, and that's part of the issue with it. It's a group of eye conditions that actually damages the optic nerve. This is the nerve that sends visual information from your eye to your brain, and we really do need it for good vision. It's critical. And as we damage that optic nerve, you're going to start having visual problems. And this is related to high pressure. So glaucoma is a high pressure in the eye. Generally, sometimes people can develop glaucoma with normal pressure, but that's more rare. It can occur at any age, but again, it is more common as you get older. And it's one of the leading causes of blindness for people over the age of 60. So we often tend to forget about our routine eye exams and measuring kind of the eye pressure. But it's a good idea to get in with your optometrist or ophthalmologist annually and just get that checked. So there's different types of glaucoma. One is called open angle. And in this stage of glaucoma, there's really no symptoms, okay? Gradually, you'll start getting these patchy blind spots in your peripheral vision. But in later stages, you're going to start seeing your central vision, like right in the middle, kind of be affected. In acute angle glaucoma, you can have symptoms, okay? So you can get severe headache, you might have eye pain, nausea, vomiting, blurry vision, start seeing halos or colored rings around lights, might notice some eye redness, and that really is a medical emergency. So if this happens, you probably would want to seek care in the emergency department where you can have access to an ophthalmologist immediately. There's another form of it called normal tension glaucoma. And again, there's no symptoms in the early stages. This just causes a gradual blurring of the vision. And in later stages, you might get loss of your peripheral vision. So what are some risk factors for glaucoma? Well, you can have high internal pressure, as we talked about. We call this being a glaucoma suspect. So your doctor may call you a glaucoma suspect when they see you. And that just means that you've got a slightly elevated pressure, but not high enough yet. And they're going to watch you. And that means you just have to go in annually. So if you go in for an eye exam and you're a glaucoma suspect, make sure you're keeping up with that. Other risk factors, being over the age of 55, having a family history of glaucoma, certain medical conditions, diabetes, migraines, hypertension, even sickle cell anemia put you at higher risk. Actually having thin corneas in the center, that puts you at risk for glaucoma. And if you have any extremes of vision, if you're extremely nearsighted or extremely farsighted, that actually puts you at increased risk as well. And then if you've been taking any type of medicine, like corticosteroid eye drops or any special eye drops like that for a long time, sometimes that can put you at risk also for glaucoma. So prevention is really the key for glaucoma, as you might imagine, because there aren't symptoms early on. The American College of Ophthalmology recommends a comprehensive eye exam every 5 to 10 years if if you're under 40, every 2 to 4 years if you're 40 to 54 years old, and every 1 to 3 years if you're 55 and older. So really trying to maintain your eye health and making sure that you're not just going for your complete physical exam, but getting a complete eye exam as well. So let's move on to another age-related eye condition called age-related macular degeneration. So otherwise known as AMD. So in AMD, acute macular degeneration, what you lose first is your central vision. So a little different than glaucoma where that peripheral goes first. Here you start losing that central vision. You won't be able to see fine details when you're looking at something. But interestingly enough, your peripheral vision will remain pretty good. So age-related macular degeneration is actually very common. It's a leading cause of vision in people over the age of 50. There's two types. There's one called wet and one called dry. Not super important. About 80% of people, though, have the dry form. And it's basically where the macula gets thinner with age. And then again, you get tiny clumps of protein called drusen that'll grow. And that's how you start losing that central vision. The wet form, it's less common, but much more serious. You get new abnormal blood vessel growth, so new vasculature under the retina, and then those can leak some fluid and cause scarring of the macula, and you may lose vision faster with the wet form of macular degeneration than with the other form. So you're more likely to develop AMD if you eat a diet high in saturated fat, if you're overweight, if you smoke, over the age of 50, and have high blood pressure. And again, if you have a family history of AMD, also put you at risk for this. So if you do have a family history of that, make sure you're seeing your eye doctor annually. Right now, there's not a lot of great treatment for it. There are some nutritional supplements that have been recommended for AMD. There was one large study that found people with certain types of that drusen, that protein, can slow their progression of AMD by taking certain vitamins and minerals, things like vitamin C, vitamin E, lutein, zinc, and copper. So things that could help, but again, unfortunately, not great treatments for macular degeneration. It's not a cure, but just to slow the progression of it. So now there are some other eye healthy foods your ophthalmologist might also recommend. But again, you should be eating a healthy, balanced diet. And again, we always kind of, discuss these, but those dark green leafy vegetables, spinach, kale, along with those yellow and orange vegetables, other colorful things, these have those antioxidants, and that's really important for eye health. Also, eating fatty fish like salmon can also lower your risk for early or advanced age-related macular degeneration because of its high omega-3 fatty acid content. So things to think about just as you're aging to incorporate into your diet that could hopefully prevent diseases like this. So lastly, another topic that I wanted to touch on that we've all heard of and is a relatively common disorder is diabetic retinopathy. Now, diabetic retinopathy is a complication of diabetes that affects the eyes. It's caused by damage to those tiny little blood vessels that we have in our eyes, um, and are in the retina. So at first, kind of similar to those other eye conditions we talked about, there might not be a lot of symptoms or only mild symptoms early on, but it can have devastating complications such as leading to blindness. So we really want to make sure we're monitoring for diabetic retinopathy if you have type 2 or type 1 diabetes. You may develop spots or little dark strings that are floating in your vision. We call these floaters. A few floaters are normal and people have those, but if you see a big flurry of them, sudden onset of them, that can be a warning sign. If suddenly you get blurry vision, if you have fluctuating vision, one day it's clear, one day it's blurry, if you have any dark or empty areas of vision, like visual field loss, where you just feel like I can't see part, out of my right eye on the latter half of it. These are all signs or symptoms that could indicate that you're having issues with diabetic retinopathy. So how do we develop diabetic retinopathy? Well, this really is caused by uncontrolled type 2 diabetes. Having too much sugar in the blood leads to blockages of those tiny blood vessels in the back of our eye that nourish our retina. So it essentially cuts off that blood supply, and the retina, tries to develop new little pathways and new blood vessels. But because those new blood vessels don't form properly, they leak. And it's that leaking of the blood that then causes all the visual problems. But the underlying issue is too high of elevated blood sugars over time. So anyone who has diabetes can develop diabetic retinopathy, and the risk of the eye condition can increase if you have diabetes for a number of years. You've had it for many, many years. Again, if you've had poor control, very elevated hemoglobin A1C levels, and if in conjunction with that, you have high blood pressure, high cholesterol, and you smoke, you're really increasing your risk for developing diabetic retinopathy. So things to keep an eye on. The complications we sort of mentioned, but diabetic retinopathy, again, it's those abnormal blood vessels that grow, and what can happen is when they bleed, so it's called a vitreous hemorrhage. So the new blood vessels can bleed into the jelly-like substance of your eye. And if it's a small amount of bleeding, you might only see a few dark spots, maybe a few floaters, but in the severe cases, that blood can really fill up that entire vitreous chamber and completely block your vision. So the hemorrhage by itself may not cause permanent vision loss because the blood can clear, but you would need to seek care immediately. A more serious complication is a retinal detachment. The abnormal blood vessels associated with diabetic retinopathy, they can stimulate scar tissue formation, and then that scar tissue pulls the retina away from the back of the eye. Again, you might see sudden onset of floaters, flashes of light, or severe vision loss. So that is a medical emergency. A retinal detachment is definitely something that if you suspect or think, you should be seen immediately in the emergency department. And then, of course, a final late complication of this is blindness. The diabetic retinopathy, macular edema, glaucoma, or even a combination of all of these things can lead to complete blood loss in diabetic retinopathy. So you want to focus on managing any or all of those conditions to prevent any worsening of the retinopathy. So what else can you do? Manage your diabetes well. Monitor your blood sugars. You might need to record your blood sugars several times a day. Keep an eye on it. Talk to your doctor if you feel like your current regimen isn't keeping your blood sugars in a normal range. Also, make sure that you're not ignoring your blood pressure and your cholesterol levels. Make sure that those are kept low. If you smoke, try to quit smoking. Just adds to the more inflammation in the eye, and just be really aware of any vision changes. And if you notice anything, get in right away, especially if you notice blurry, blindness, floaters, hazy vision, anything like that. So I hope this was sort of a helpful review on some of the more common eye conditions that can exist. It's an area of the body we don't think about often, but can really have big impacts as we age, on our livelihood and just overall health and enjoyment of life. So I encourage all of you to kind of make a screening eye exam as soon as you can. So thanks again for joining in. We'll see you next time.